All right, part 7. We are going to finish up the connective tissues. Previous part, what we did is we took care of CT proper. So in this one, we are going to take care of cartilage, bone, and blood. For cartilage, there are 3 types of cartilage. The first one and the most widespread one is going to be hyaline cartilage. So it's amorphous. It does have collagen fibers. If you're in my hybrid or seated and you're listening to this, you've known in lab, I've mentioned this quite a few times, that hyaline cartilage, although we can't see any fibers and we can use that to help us detect if it's hyaline cartilage, I just wanted to stress it still does have collagen fibers. So the lacunae are the spaces, and the cell type that lie in there are chondrocytes. And again, on a previous one, I mentioned chondroblasts. Don't worry about that here. So it's going to support, reinforce, cushion, and the places that we're going to see it. Costal cartilage, there where the ribs attach to the sternum, there are going to be these little bits of cartilage. That's the costal cartilage. It's found in the embryonic skeleton and in the epiphyses, or in the end of long bones. And still within this unit, we're going to be talking about the structure of long bones. So hopefully that will kind of reinforce what we're talking about here in terms of where hyaline cartilage is found. And this is relatively an easy one to discern, to detect. Here are the lacunae, the space, and in there is the chondrocyte. And all of this is this ECM. And as I was saying, where the ribs attach to the sternum, they're going to be these bits of cartilage. That's called the costal cartilage. All right, another type of cartilage that we have is elastic cartilage. So it has elastic fibers. So it has a little bit more flexibility. And where we're going to see an epiglottis and the pinna. The pinna is the external ear. So those are the spots that we're going to see elastic fibers. And if you've done reading, elastic fibers are typically referred to as yellow fibers. That's the way they appear normally. When you take a look at anything with a microscope, more often than not, these elastic fibers are going to appear black because of the stain that they use. Will preferentially bind to the protein elastin. So here are these elastic fibers. So you still see the lacunae and the chondrocyte inside. So again, cartilage is very distinctive in terms of looking at it microscopically. So when you see those chondrocytes, there's 3 types. If you don't see fibers, it has to be hyaline cartilage. If you see fibers, it's either going to be fibrocartilage or elastic cartilage. If the fibers are really thick and black, then that's going to be elastic cartilage. All right. Fibrocartilage, it just has so many more collagen fibers that we now can see them. So still has collagen fibers like in hyaline, but there's so many and they're thicker that we actually can see them now. So this is really going to give us that tensile strength because there's so many collagen fibers. And remember what I said at the beginning of this chapter, that collagen fibers, I want you to think of providing tensile strength. So where we're going to see them are in the intervertebral discs, the pubic symphysis, and the discs of the knee joint. The pubic symphysis, if you think of the os coxa, the hip bones, where they come together at the inferior aspect, that's the pubic bone, and where those two meet, there's this pad of fibrocartilage. So that's what the pubic symphysis is. And we can see here, again, we see these the lacunae with the chondrocytes inside, and we see fibers. Right? They're not so dark and so black, so that's what's going to make this then fibrocartilage. So that's it for the cartilage. We have bone. The only bone that I'm really going to focus on here is going to be compact bone. So there are collagen fibers found in bone. There are still lacunae, the spaces. The cells there are going to be osteocytes, and it has a very rich blood supply. Muscles would not work, at least the way that we have them, would not work if we didn't have the bones to act as levers. And so it's going to store calcium, minerals, fat, and the marrow inside the bones is going to be where blood cell formation, hematopoiesis or hemopoiesis, takes place. And this too is a pretty distinctive one to take a look at. They look at tree trunks, and in the next two chapters, not units, sorry, within this unit, we're going to be talking about all of the different parts here and what they are and what they do. And then last, we have blood. We have red blood cells, white blood cells. The matrix is plasma, which is fluid contained within blood vessels, and they transport oxygen, waste, those sorts of things. And we see this here. Here are all the red blood cells. They are lighter in the middle because they are biconcave. So if we're taking a look at a side view, the blood vessel goes like this and goes like that. So in the middle, there's less stuff in between the two plasma membranes, so more light passes through, and that's why they appear lighter in the middle. There's a platelet, and the two of the 5 most common white blood cells that you will see are going to be neutrophils and lymphocytes. And that's it for, and sorry, you don't have to know the names of these. We'll go over that in 169. That was more just FYI to be clear. And that's the end of this. All we have left are muscles and nerves.